Hi, have you ever seen anybody who has got a swelling in the neck? Yes, you're right. It might be thyroid swelling. Many of the patients these days says that I've increased weight because of thyroid problem. So yes, we are seeing thyroid problem very common. And in many of the patients, when this thyroid is growing in a size beyond its normal size, it is seen as a swelling on the neck. So whenever you see any patient or any dear ones of yours having a swelling on the neck, it is better you get an ultrasound done. So when you do an ultrasound, you can see that there is a thyroid gland in front of the neck, in front of the trachea, which increases in size, causing the pressure symptoms. So what is the function of thyroid? Thyroid secretes T3, T4 hormones, and these are controlled by TSH. So when you do a blood test, we get to know what are the normal values and is it whether these T3, T4, TSH is normal or abnormal. So whenever it is normal, but still you see these nodules or growth in the thyroid, then you have to treat them, because this thyroid lies on the trachea and nearby esophagus. So whenever it increases in size, it compresses the trachea and the esophagus. So what does happen? The patients will feel difficulty in breathing, difficulty in swallowing. That means that the thyroid has grown beyond its size and compressing over these important structures. It is very important that we treat this thyroid. What is the surgical option? They cut over here and they remove the abnormal thyroid. But you know that neck is something which we see every day. You know, everybody notices the neck, and if you have a cut on the neck, everybody would come and ask you, like, what happened? Is it thyroid cancer? It is thyroid. So it is important that we do a minimally invasive procedure rather than a surgical procedure. So as an intervention radiologist, this is Dr. Balaji, senior consultant. I offer thyroid microwave ablation. So what is thyroid microwave ablation? Whatever abnormal thyroid gland you are seeing, I put a small needle inside. First I do an FNAC to say that it's a benign, not cancerous tissue. And once we get to know that it's a benign thyroid hypertrophy, then we put this same needle, which is little bigger in size, which is microwave probe, and enter into the lesion. We burn the lesion within that thyroid and we come out. So it's a daycare procedure, not even daycare, you can call it as office procedure, because within 2 hours the patient is discharged and there is no signs of any cut or any sutures or any marks on the neck, which is very important for young females who have to get married, or any other individual as such. Like, carrying a big mark on the neck is a social taboo. So they even don't want to get the procedure done, or they don't want to undergo the surgery. So I offer thyroid microwave ablation, which is very minimally invasive. One small needle puncture, that mark also it just disappears within a week or 15 days. And believe me, it's a daycare procedure. You can just come avail this procedure and get rid of the neck swelling. Thank you.